Your feet are the farthest point from your heart, and that makes them a kind of early warning system. When something goes wrong with your circulation, your nerves, or your organs, your feet often know before you do. Doctors in ancient Egypt examined feet to diagnose disease. Modern physicians still do the same. That burning you feel at night, that numbness that comes and goes, the swelling you blame on long days. These are not random. They are messages. Some are harmless, others are urgent. Knowing the difference could change everything. Let us decode each signal your feet might be sending. Burning feet. It starts as warmth in the soles, maybe a low heat you notice at the end of the day. Then it gets worse. Some people describe it as walking on hot sand. Others say it feels like fire beneath the skin, intense enough to wake them at 3 a.m. This burning usually means the small nerve fibers in your feet are damaged and misfiring. Diabetes is the leading cause, often damaging nerves for years before a person knows their blood sugar is elevated. High glucose slowly destroys the tiny blood vessels feeding your nerves, and starving nerves send false pain signals. Vitamin B12 deficiency does something similar, which is why burning feet are common in strict vegans and older adults who absorb less B12. Alcohol is directly toxic to nerve tissue, making this symptom frequent among heavy drinkers. Kidney disease, thyroid dysfunction, and certain infections, including HIV, can all trigger it. The burning worsens at night, partly because lying down pools blood in your feet, and partly because fewer distractions make you more aware of the sensation. If your feet burn regularly, your body is telling you something is affecting your nerves. Numbness. Losing feeling in your feet is more dangerous than it sounds. You might think numbness is simply the absence of sensation, an inconvenience at worst. But consider this. Every year, thousands of people lose toes or entire feet because they could not feel a small cut becoming a serious infection. Numbness means the nerves responsible for sensation have stopped working properly. This often represents a later stage of the same process that causes burning. First, damaged nerves overfire and create pain or heat. Eventually, they stop firing altogether. Diabetic foot ulcers are a leading cause of amputation precisely because people cannot feel wounds forming on numb feet. A pebble in the shoe, a blister from tight footwear, a small puncture. Any of these can become catastrophic when you cannot sense them. Beyond diabetes, numbness results from compressed nerves in the lower back, reduced blood flow from arterial disease, B12 deficiency, autoimmune conditions, and certain medications, including chemotherapy drugs. Temporary numbness from sitting awkwardly resolves in minutes. Persistent numbness is a red flag. Your body needs investigated. Tingling, pins and needles, that prickling sensation, like tiny electric sparks, sits between burning and numbness on the spectrum of nerve signals. You have felt temporary tingling after crossing your legs too long. Blood flow returns, nerves recover. Sensation normalizes within moments. Chronic tingling is different. It represents nerves that are damaged but still fighting, sending scrambled messages your brain interprets as prickling or crawling. This makes tingling particularly valuable as a warning sign. It often appears before permanent nerve damage sets in. Catching the cause at the tingling stage, whether diabetes, vitamin deficiency, or circulation problems, gives you a window to intervene. Poor blood flow causes tingling as oxygen-starved nerves struggle to function. Tarsal tunnel syndrome, similar to carpal tunnel but at the ankle, compresses nerves and produces tingling along specific parts of the foot. Spinal disc problems can irritate nerves before they even reach your legs. Tingling that affects only certain toes usually points to a localized issue. Tingling that spreads or comes with weakness suggests something more systemic. Either way, persistent tingling is an early alarm worth heeding. Swelling. When your feet and ankles puff up, fluid has leaked from your blood vessels into surrounding tissue. Gravity pulls this fluid downward, which is why feet swell before hands or face. The question is whether swelling reflects something temporary or something serious. Standing all day, sitting on a long flight, eating salty food, being pregnant, these cause fluid retention that resolves with rest and elevation. This type of swelling affects both feet equally and goes down overnight. Concerning swelling looks different. Heart failure causes swelling because a weakened heart cannot pump blood efficiently, allowing fluid to back up in the body. Kidney disease leads to swelling when damaged kidneys fail to filter excess fluid. Liver disease reduces production of proteins that keep fluid inside blood vessels. These conditions cause persistent swelling that does not resolve with elevation. Most alarming is sudden swelling in one leg, often with pain, warmth, and redness. This pattern suggests deep vein thrombosis, a blood clot that can travel to the lungs and become life-threatening. Certain medications, including blood pressure, drugs, steroids, and some antidepressants, cause swelling as a side effect. If your feet swell most days without obvious cause, the fluid is delivering a message about your heart, kidneys, liver, or blood vessels. Cold feet. Constantly cold feet might seem trivial, something solved with thicker socks. Sometimes that is true, but feet that stay cold, regardless of external temperature, are often signaling circulation problems. Peripheral artery disease narrows arteries supplying blood to your legs and feet, reducing the warm blood flow that maintains temperature. Feet with this condition often look pale or slightly blue, along with feeling cold. Raynaud's phenomenon causes blood vessels in fingers and toes to overreact dramatically to cold or stress, cutting off circulation temporarily and turning skin white, then blue, then red as blood returns. Hypothyroidism slows metabolism body-wide, reducing heat production and leaving extremities chronically cold. Anemia means blood carries less oxygen, which can leave feet cold and pale. Diabetes damages both nerves and blood vessels, frequently making feet cold, while also reducing the ability to sense temperature accurately. Smoking accelerates arterial damage and constricts blood vessels. The distinction that matters is whether your feet get cold in cold conditions, which is normal, or stay cold, even in warm environments. The latter suggests your circulation deserves attention. Persistent foot pain. Pain that does not go away forces you to pay attention, which is exactly its purpose. Location and timing provide crucial clues. Pain in the heel, worst with your first morning steps, often indicates plantar fasciitis, inflammation of the band connecting heel to toes. Millions of people develop this from repetitive stress, excess weight, or shoes without arch support. Pain in the ball of the foot suggests metatarsalgia or Morton's neuroma, a nerve thickening between toes that can feel like standing on a pebble. Sudden severe pain in the big toe, especially at night, with redness and swelling, points to gout. Uric acid crystals accumulate in the joint and trigger intense inflammation. Gout attacks are memorable. People describe them as the worst pain they have experienced. Arthritis produces pain that worsens with activity and improves with rest, affecting the foot's many joints. Stress fractures from repetitive impact cause pain that increases with walking and decreases when you stop. Pain only at rest, particularly at night, can indicate nerve problems or rarely something more serious. Walking on a painful foot often worsens the underlying problem, making accurate diagnosis important. Cracked heels. Deep cracks in the heel skin seem like a minor cosmetic issue until they split open and bleed. Then they become painful and potentially dangerous. The thick skin on your heels is designed to withstand pressure, but without moisture, it loses flexibility and fractures. Dry winter air, hot showers, harsh soaps, walking barefoot, and open-backed shoes all contribute. These cracks usually respond to consistent moisturizing and proper footwear. However, cracked heels that do not heal despite good care can signal underlying conditions. Thyroid disorders affect skin moisture throughout the body. Diabetes impairs circulation and nerve function, reducing the body's ability to maintain and repair skin. People with diabetes may not feel cracks forming, allowing small wounds to become infected. Eczema, psoriasis, and nutritional deficiencies, including zinc and omega-3 fatty acids, compromise skin integrity. Obesity increases pressure on the heel pad, forcing it to expand sideways and stress the overlying skin. When cracked heels persist or worsen despite treatment, they may be revealing something deeper happening inside. Yellow toenails. Thick, yellow, crumbly nails make people hide their feet, but appearance is not the only concern. That discoloration usually means fungus has invaded beneath the nail plate. Fungi thrive in the warm, moist environment inside shoes, and once established under a nail, they are remarkably difficult to eliminate. The nail itself shields the infection from topical treatments, which is why over-the-counter products often fail. The infection spreads slowly, eventually causing the nail to separate from its bed. Left untreated, it can spread to other nails, and even to other people sharing barefoot spaces like bathrooms and pools. Beyond fungus, yellow nails occasionally indicate yellow nail syndrome, a rare condition linked to lung disease and lymphatic problems. Psoriasis can yellow and pit nails. Heavy use of dark nail polish stains nails over time. Smoking deposits tar that discolors nails. Sudden yellowing of multiple nails, especially with other symptoms like breathing difficulty, warrants investigation beyond assuming fungal infection. Skin discoloration. The color of skin on your feet reflects what is happening beneath the surface. Redness with warmth and swelling suggests inflammation or infection. A red streak traveling up from the foot could indicate spreading infection requiring immediate treatment. Paleness signals reduced blood flow, whether from arterial narrowing, anemia, or sudden vessel blockage. Blue or purple tones mean tissues lack adequate oxygen, potentially from cold exposure, poor circulation, or heart and lung problems. Brown or bronze staining on the lower legs and ankles appears in chronic venous insufficiency, where struggling leg veins allow blood to pool and iron to leak into tissue, permanently discoloring skin. Dark spots on soles or under nails are usually bruises, but melanoma can develop in these locations. Any new or changing pigmented spot deserves examination. Your feet should generally match your body's skin tone. Significant color changes carry diagnostic information. Itching. Persistent foot itching, especially between toes, usually means fungal infection. Athlete's foot spreads easily in locker rooms, pools, and shared showers, causing scaling, cracking, and intense itch that can extend to soles and sides of feet. Contact dermatitis from shoe materials, dyes, or sock detergent produces itchy reactions. Eczema and psoriasis cause dry, itchy patches. Dry skin without underlying disease frequently itches on heels and soles. Scabies, caused by microscopic mites burrowing into skin, produces severe itching worse at night. Less commonly, itching without visible rash indicates liver disease, kidney failure, or thyroid problems. When scratching does not satisfy or itching persists despite treatment, something beyond the skin surface may be responsible. Skin peeling. Flaking skin on the feet shares many causes with itching. Fungal infection disrupts normal skin turnover, shedding sheets of dead skin along with odor and irritation. Dry skin from environment or poor moisturizing causes peeling without inflammatory signs. Excessive sweating, paradoxically, causes peeling as waterlogged skin loses integrity. Sunburned feet peel as damaged skin dies. Allergic reactions blister first, then peel during healing. Certain systemic illnesses, including scarlet fever, cause dramatic peeling of palms and soles as the disease resolves. Peeling accompanied by fever or rash elsewhere requires prompt evaluation. Isolated foot peeling usually resolves with antifungal treatment or better skincare. Foot odor. Though embarrassing, foot odor rarely signals serious disease. Your feet contain over 250,000 sweat glands, more per square inch than anywhere else on your body. Sweat itself has almost no smell. Odor develops when bacteria break down sweat and dead skin into pungent compounds. Enclosed shoes, synthetic materials, wearing the same pair daily without drying, and stress-induced sweating all worsen odor. Fungal infection between toes adds its own distinctive smell. Good hygiene, breathable footwear, and moisture-wicking socks solve most cases. Exceptionally strong odor occasionally indicates hyperhidrosis, excessive sweating beyond normal needs. Your feet carry you through life while quietly monitoring your health. Each signal they send, burning, numbness, swelling, discoloration, connects to specific processes happening inside your body. Some signals mean nothing more than dry skin or tight shoes. Others reveal diabetes, heart disease, or circulatory problems years before other symptoms appear. The difference between harmless and urgent often lies in persistence. A symptom that comes once and leaves is usually nothing. A symptom that returns repeatedly or never goes away is your body asking for attention. Your feet are speaking. The question is whether you understand what they are saying.